far, and I believe 3 deaths may be the last count, but of course he's going to update us in just a few moments.
Welcome to Harris County's Office of Homeland Security and Emergency Management. I'm Mark Sloan. I'm the coordinator for the office. This morning, we're here in the Emergency Operations Center, and it's busy, but it's not as busy as we've seen during hurricanes. During Hurricane Harvey, there were over 525 people and 119 agencies functioning during that weather event. We still have the same number of partners, but we're doing it remotely. We have much fewer partners here in the Operations Center. And I want to say thank you to all of our first responders, our partners, the hospitals, the doctors, the nurses, and most importantly, you, the public, for listening, for understanding that during these unprecedented times, we've had to do some extraordinary things in order to make sure that we try to mitigate what we're dealing with the coronavirus. COVID-19 has put us in situations that we never thought would be possible during our lifetimes. But we're taking the appropriate actions in the Operations Center with the plans and the processes that we have for all threats and all hazards. So thank you. Thank you for listening. Judge Hidalgo has done extraordinary things in recent days that we never thought we'd have to do. We put orders in place to isolate. We had to close bars and restaurants and mass gatherings. It's unfortunate, but we're all in this together. And by working together, we will be successful to try to mitigate the spread of the virus, taking the burden off our hospital systems. Public health is working diligently on the tactics to make sure that testing continues. It's not as fast as we wanted, but we're doing everything we can to make sure that we take care of our community. So the entire region, the state of Texas, the country, is all doing their best to make sure that we take care of this as quickly and effectively as possible. Are there any questions?
Yes, sir. From Adam Bennett at KHOU. In a couple of weeks, we are probably going to have a lot of patients in the hospitals. Do you believe we're going to have enough beds overall? What other places are you looking to house overflow patients?
So the question was about surge capacity within the hospitals. Public health is working diligently. We have an excellent partner in the Southeast Regional Texas Advisory Council called CTRK, and our Catastrophic Medical Operations Center is activated. They're coordinating with the entire region, 25 counties to be in total in their area, to work with the hospitals to build that capacity. The hospitals have been excellent partners in order to reduce their current caseload that they have in their hospitals to provide additional beds for a surge. We're also talking with our federal partners in order to build external capacity at a variety of locations if the need comes. Will we have enough beds? We hope so, but we don't know that yet. All of the actions that we're taking now is to help reduce the burden on the hospitals, network, and systems.
Next question comes from Marian Martinez. What is the status of acquiring testing kits? Private facilities seem to have more access to kits through private vendors than county/local governments. Can you explain what the county's process is for getting kits and where are you getting them from?
So the question was about testing kits and their availability. At the local governmental level, we are coordinating with our federal partners at HHS who have opened the test sites that we get here locally. So as you've heard from our public health, both at the city and the county, on our test sites, they provide the kits, the PPE. We're providing the additional support in order to get the testing completed. Numerous local partners in the private sector